Hi, my name is Kale Owens. I'm a student nurse here at Wilson State College, and today I'll be performing a head-to-toe assessment on a newborn. So before I go into the patient's room, I'll perform hand hygiene, and then I will knock, open the door, introduce myself, and close the door to ensure privacy between me and the patient. So before I get started, I'll ask the patient if they could state their name and date of birth, and I'll make sure to match that with my information. So our patient is Shirley Close, 54-year-old female, and I made sure that matches her wristband. Performing hand hygiene, once again, when I get in the room, don gloves, and just inform her that I'll be doing a quick head-to-toe assessment on her newborn baby girl. Before I start that, I will make sure the baby's laying nicely. She's not crying or anything. She's just swaddled up next to mom, so I will unswaddle her and make sure to confirm my three patient identifiers. So I have the ankle band, I have the wristband, and then the umbilical clamp, and they all match, and they all match the information on mom's wrist as well. So I know this baby goes to this patient. So with that, I can start my head-to-toe assessment of baby, trying my best to keep her covered. And so I'll begin with the head, so I can make sure that the anterior and posterior fontanelles I'll just palpate them softly. They're soft, they're not bulging, they're not indenting in any way. The sutures are slightly overlapping, but that's okay, that's normal for this baby. She was a vaginal birth, so that's going to be normal for the first couple hours. I can then move on down to the eyes, nose, ears, and throat. So there's no signs of cyanosis, there's no leaking discharge of any sort, there's no palate in the mouth. The outer canthus of the eyes match with the tops of the ears, which is a normal and good sign for baby. Baby's looking around freely. There's no yellowing of the sclera. There's no nasal flaring, which would be a sign of respiratory distress, so that's good. Baby's having good respirations as of right now. At first glance, baby's neck folds are fine. She's moving her head from back and forth normally, so that's good. So then that's all checked off. I can then go down to baby's abdomen. So I'll use my neonatal stethoscope to listen to baby. I'll have to listen to the apical pulse for a full minute because baby's heart rates are irregular. So once I'm doing that, I will note that the baby's heart rate was 140, which is normal, and then I can then go on to listening to baby's respiration sounds as well as their respiration rate, and to see if they're in any distress. I can't just visually look, as babies have abnormal breathing patterns, and I want to make sure that there's not any abdominal muscular movements for breathing or retractions. So I'll just listen on a couple different places. And I'd also listen for the respiration rate for a full minute as babies breathe irregularly as well. So that all checks off with the heart and lungs. I would then go down to the baby's bowel sounds and listen to all four quadrants, making sure that they're all active. As I'm down here, I can then assess the umbilical cord as well, make sure that it's kind of drying up right now. There's no signs of infection. It's not bleeding. It's not have any yellow discharge or anything like that. There's no discomfort with baby with it. Then I can go on to getting baby's very own thermometer and put it in their folds of their armpit to make sure I get a good contact and hold it down, making sure in the axillary temperature. While I'm doing this, I can then look at baby skin integrity, making sure there's no bumps, bruises, there's no cuts in the skin, there's no signs of cyanosis or anything like that. Baby's moving their arms freely up and down and out, so that means that the clavicle, there's no signs of breakage. My thermometer just went off, so it's saying 98.8, so that's good. When I'm done with the assessment, I can swallow baby up, give her back to mom, or leave her here. The magical number for that for a baby's temperature is 97.7, so she's above that, so that's good. I can then move down to baby's legs, making sure that she's kicking. Check cap refill in both the toes and the fingers. They're both below 2 seconds, which is good. We got 10 fingers, 10 toes, that all adds up. Baby's kicking freely. I can then rotate baby onto their side to assess the back side of them as well. So I'll look at the spine, making sure that it's straight. Look at the very bottom, by the coccyx, making sure there's no tuft of hair or there's no dimple. When I have the baby on their side, I can then as well listen to their respirations on the back. So listen to about 3 different positions, back and forth, side to side, comparing them bilaterally to each other, making sure that it is equal, there's no distress or anything, no wheezing. I can then roll baby back onto their back, and before I leave as well, I'll have to assess baby's diaper in the genitalia region. So I'll just take the baby's diaper off. I know that the diaper's still clean. The baby has voided and had a bowel movement in the first 24 hours of life, so that is good and expected. We don't need to have any further investigations with that. We just need to keep recording eyes and O's with baby. If the diaper was messy or full, I would change it before giving baby back to mom. Making sure that there is no abnormal drainage or anything like that. I could inform the mom that if there was some pink drainage in the diaper, that's normal for the first 24 hours of life. So I can wrap baby back up in their diaper. I would also check the baby's backside, making sure that there's nothing going on back there as well. So that would complete this head to toe baby. Everything checks out, so I re-swaddle baby back up. And if mom would like to hold her, I could then give it to mom to hold on her chest, have a cap on baby, and then I would make sure to ask if the mom needs anything before I leave the room, take my gloves off, perform hand hygiene, and walk out of the room and go and document my findings.